Hi, Professor. It's Andrea Cedeno. Today I will be acting as a coach and I'll be presenting to different athletes and their parents in the high school level. So today I'll be talking about the ulnar collateral ligament injury, also known as the UCL injury for short. Um, First, let's get into some background and etiology. It is an overuse injury on the ligament in the elbow, causing the tissue to be irritated and eventually tear apart. It's most common in the overhead throwing position athletes, such as volleyball players, tennis, water polo, and the most people are usually familiar with are the baseball players because they're always getting Tommy John surgery, I feel like, especially the pitchers, but it is not specific to them. There can also be a traumatic blow to the elbow causing the injury. Say, like, you're trying to break your fall and you land on your elbow the wrong way. There are 3 grades to the injury. Grade 1 is when the ligament is stretched but it's not torn. Grade 2 is going to be when the ligament is stretched and it's partially torn. And then grade 3 is when the ligament is just completely torn. Although you'll still be able to do the daily activities you're used to, more specific to the athletes, they're not going to be able to do their sport with the overhead repetitiveness because that will hurt. Okay, for the next slide, I have the signs and symptoms. So, there is going to be pain along the medial aspect of the elbow due to the valgus and repetitive forces. Also, I repeated medial. It's going to be the pain over the medial collateral ligament, but also the ulnar collateral ligament, the MCL and UCL. So there might be a numbness in the 4th and 5th digit, or 4th and 5th digit finger. The next sign, there's gonna be pain and laxity when you're taking the valgus stress test, which the valgus stress test is gonna assess the UCL and MCL. Also, you might feel a sudden pop along the inside of the elbow if it is a traumatic blow to the elbow kind of injury. You're gonna feel severe pain, obviously, and then the loss of the ability to throw. So the last slide's gonna go over management, and then I added a little prevention thing for next time. So first, if it's not that serious, you're gonna want to rest in ice. Also NSAIDs, which are non-steroidal anti-inflammatory drugs, like aspirin and ibuprofen, like I listed there. For not the as serious UCL injuries. And if this does help, the rest in ice other than the drugs, you're gonna want to slowly start adding strengthening exercises to the UCL area, and some go to a physical therapist. You can consider going to physical therapy just to have someone there to make sure holding you accountable and just giving you the best exercises to help that UCL injury. For the full tear, grade 3 serious torn ligament, Tommy John surgery is needed. The surgery is just the reconstruction of your tendon using your own body graft. The ulnar nerve may get moved sometimes, but yeah, you hear it a lot in baseball. You can return 22 to 26 weeks post-surgery, but it will take a full 18 to 24 months for a full recovery. And after that, you can get a brace for support. And then for prevention, I added just adjust accordingly to your elbow, manage corresponding to how you feel. So just don't overdo it. Don't count your pitches or your arm movements if you're swimming or other um, sports. And yeah, just hold yourself accountable and don't push yourself. And then there's my resources, and that's going to be it for my presentation. I hope you enjoyed. Thank you.